Welcome to the program Let's Talk Health and Wellbeing. Today on the program, we'll be discussing the topic of depression. Depression is a predominant mental health condition worldwide and followed by anxiety, schizophrenia, and bipolar disorder. In the UK, 3 million people are diagnosed with depression annually, and over 6,000 people commit suicide due to depression. And 1 in 10 persons will be diagnosed with depression at some point in their lifetime, and 50% of these are more likely to have a relapse. And with me on the studio is Dr. Mani, who is a consultant psychiatrist. Thank you for coming to the program. It's really a pleasure having you. So, doctor, what exactly is depression?
So, like you mentioned earlier, depression is a mental disorder and can be a serious mental disorder. It's one of the commonest mental disorders that we deal with. I guess we all get sad at any point in time, so sadness is a normal human emotion. Uh, but in depression, people suffer from sustained low mood or sadness for a period of time, and they lose pleasure. They don't enjoy things that they do. They lack concentration. They lack motivation, and they can also have other biological, what we call as biological symptoms, like they don't feel like eating or drinking. Because of that, they can lose weight over a period of time. They have difficulty in sleep, for example. They don't, even if they go to bed, they can't fall asleep, and they wake up quite early in the morning. They can have sexual side effects. They don't enjoy uh, uh, the sexual side of pleasure either. So it can be quite debilitating for people when they suffer from the depressive symptoms. So yeah, it is it is it is it can be serious mental disorder.
Okay. And what exactly causes depression?
So we talk about various causes of depression. There isn't one particular cause for depression. So, for example, genetics is talked about as a cause. So, do people have genetic propensity? Uh, yes, it does run in families.
Okay.
So, if you have a family member who has suffered from depression, you do have a higher risk of developing depression. However, it doesn't mean that somebody is having depression in your family, therefore you will develop.
Okay.
It's just that you should be aware that you could be at a higher risk of depression. Now we talk about lots of other things as well, like the life events. Any life event can be quite a stressful time, and it can precipitate depression in someone. For example, unemployment, relationship difficulties, money problems, debts. All of them can trigger the depressive symptoms.
Okay.
So we talk about personal factors as well. Uh, so people have their life experiences from the past, how it shapes their current personality, how they're going to cope with the stress.
Okay.
Drug and alcohol is very interesting in itself, because people who develop depression can take to drug and alcohol to cope with them. And people who have been drinking heavily, it can cause depression as well. So it can cause, and it could be the effect of depression as well. So
Okay.
that's a quite a high risk of group category of people that we talk about.
Okay.
And we also talk about serious medical illnesses. Anybody who is, say, chronic pain, for example.
Okay.
People can suffer from chronic pain over a period of time, and that can precipitate depression as well. So there's a myriad of things that we talk about which can cause depression.
Okay.
Just be mindful of all the things that can cause depression.
So people with long-term conditions,
They can definitely
diabetes and
diabetes, even so any serious
Cancer.
life-changing cancer, for example. They are
Okay.
life-changing situations for them. So so they are very high risk of
Okay.
developing depression.
Okay. And what are the different types of depression?
So when we talk about depression in terms of severity, we talk about as mild, moderate, and severe depression.
Okay.
So in the severe spectrum, for example, you could have people, like I talked about, the profound sadness they can present with in a very severe intensity, or they can also present with what we call a psychotic depression. They can have out of out this what we call psychotic symptoms.
Okay.
The people can have the guilt feelings, which are quite profound for them, and they really lose touch with reality, for example. So they have these delusions and they can have these hallucinations. Um, it's an extreme variant of severe depression that we sometimes see. And there are also what we call as unipolar depression and bipolar depression, for example. So we have depression, so somebody who's having depression over many years, they will only have depressive symptoms.
Okay.
But we have something called a bipolar disorder, for example. They can have manic symptoms as well as depressive symptoms.
Okay.
So they can switch between depression or mania, or just present with depression and occasional mania.
Okay.
So you see them what we call as a different polarity of your mental state, for example, and we see that as well. Postnatal depression, we talk about pregnancy and postpartum period as one of the high risk periods for women, for example. So we talk about 10 to 15% of women developing depression during the pregnancy period, and immediate postpartum period is slightly higher risk compared to any other period in life as well. So the presentation during that time can be slightly different, and the people need to be mindful of the emotions that the women can present with. But yeah, so we call them postpartum depression, and that in itself, the context of it is quite interesting, quite important to know.
Okay.
And we also have things like seasonal affective disorder. Some people develop depression when during winter time, for example, and during summer times they do very well.
Okay.
And we also have slightly what we call as milder versions of the depressive symptoms that we talk about, like cyclothymia or dysthymia, for example.
Okay.
So cyclothymia would be kind of changes in the mood over a period of time, probably for a couple of years.
Okay.
So we say 2 years, but slightly milder version of what we're talking about.
Okay.
Sometimes people say it is a milder version of bipolar, but what is important to understand is they're all mood swings we're talking about. Dysthymia, very similar. For over a period of years, they have profound low mood. So yes, when we talk about depression, we talk about different, both in terms of intensity, in terms of context, and in terms of the specialized sort of things that it occurs. So we do, yeah, we do come across different types of depression presenting slightly differently.
Okay. And what are the signs and the symptoms? Are you able to see somebody and know they are depressed, or how do you pick up the sign or the symptoms to be able to help someone?
So I mean, generally you would see them, of course, low in mood. Many times they spontaneously burst into tears. So you find them crying for no apparent reason, and they would tell you that I don't know why I'm crying. Sometimes you see them withdrawn. They start disengaging from everyone. So there are telltale signs that you might want to watch out for. Yes, I mean, you would see them sad. It's much more than the normal, much more than the kind of sadness that everyone experiences. And of course, like I said, the biological symptoms, they wouldn't be sleeping at all. They can be quite anxious. They can present with loss of weight, for example. They may not be eating at all. They're quite important things that other people can notice.
So what's the difference between depression and anxiety?
So they're two completely different entities that we come across, but they can also come together as well. Okay. So anxiety is a symptom where you feel, people are generally anxious, and they can have so-called anxiety symptoms associated with that. So they can have palpitate, the heart beating faster. They can have sweating, and generally a feel of restless feel that they might have. Whereas depression, I mean, like I said, both can be associated. One can lead to the other as well, or they can occur together as well. So it's important to understand.
Anxiety can lead to depression.
It can. Severe anxiety.
You can suffer from depression and anxiety.
You can have combined together as well. Yes.
Okay. Is depression curable, or is it treatable? Or is it just manageable?
So so our experience, when I say our experience, I think generally we would say depression is one of the the treatable condition that we deal with. I mean, we talk about almost 70-80% of people being treated with either psychological treatment or with medication. that's quite a high percentage of people that you can treat with. Okay, and some people are asked the question: is it just a one-off thing? So many a time you just see an episode that happens once and it doesn't happen again at all.
Okay.
There are other people that what we call as a relapsing condition. It can come back again.
Okay.
But with the current modern treatments that are available, what we have seen is the outcomes are much better. You know, people can lead a very productive life.
Okay. So what advice, we know a lot of people who are suffering from depression and anxiety. So what advice, how can we help them?
Sure. So one of the things we talk about is stigma surrounding the mental illness generally, isn't it? I mean, I know recently there's been a talk about mental disorder, and we have seen quite a lot of people coming out seeking help. And I think it is a good thing that people are coming out, and the message should be that you don't have to suffer in silence. There is always treatment available for all of these conditions. There's always support available. When people seek, like I said, the outcome is much better if they seek help quite early, and that's what I would say. Yeah, people should come out of suffering and then start seeking help. Is what I would say.
So in the UK, we have a few services that help people with depression. Can you tell us some of those?
So there's a lot of resources, and there's a lot of people who can. So mine is the charities. The Mind charity is one of the important things, and they've got a lot of resources on their website. There are quite a lot of self-help things as well. And one of the, like you mentioned about the suicide, one of the things that does happen with severe depression is as a serious risk it's a risk of suicide, for example. So that is something that is being addressed as well. There's a Samaritans, the resources on the NHS website, for example, quite a lot of self-help groups, and there are organizations where people can pick up the phone and talk to them. And of course, there are within NHS there are mental services, for example, and these days it is taken very seriously, and people are supported quite well, I would say. So there are resources to go to. There are charities who do a fantastic job in UK, and I think people should make best use of them.
So when we talk about depression, most often we think only about adults because it has to do with life-changing events, emotional situations. But recently, we have a lot of children who have been diagnosed with depression as well.
Right, yeah.
What is the reason or the cause of the increase in childhood depression?
So again, there are myriad of reasons that we're talking about. It's a lot of societal. It's a change in the societal setup itself. I think it's causing quite profound changes in the young kids, and there's a lot of pressure as well. And these days, the kids. I mean, when I was a child, I think the kind of things that I had to do, I think my daughter probably does. I think she's under a lot more pressure, I would say, and the people and the interactions, with the advent of internet and with the advent of social media, the actual human interaction, in my view, has come down as well. I think people are probably in a darker space, especially the children, because you see them texting or whatever. Most of the communication is through them, and I think that does make a big difference. The kind of human interactions that I would have had when I was a child is probably different now. And the peer pressure, it's and then we don't even know. I mean, there's lots of online bullying that happens as well, which is beyond which we don't normally see as well. So they're subjected to quite a lot of stresses, especially the young girls as well. And the peer pressure, for example, the eating disorder is quite the pressure to be thin, and that precipitates that it is kind of depression as well. It's
trying to look like a celebrity and
exactly.
copy other people and look like them.
And it precipitates depressive symptoms as well. So I think society has changed quite a bit, and I think it is putting a lot of pressure on the children. But having said that, we'll have to be. I'll have to say there is again a lot of resources for the children to tap into as well. So hopefully.
So parents should be able to monitor their children and
Absolutely.
pick up any signs, signs of depression, and try to seek help.
Not just to dismiss it as a growing up phase either. And of course, I mean, there are lots of things which are part of the growing up phase, but people have to be mindful of the kind of trauma that these children can go through.
Okay. Thank you very much. So what else can you tell us about depression or what?
So, like I said, depression as a recognized, it is a recognized entity. It is a mental condition which is treatable. Like we have come a long way in terms of how we recognize depression, how we support people, and how we treat people. And there's a lot of treatments which have got evidence based now, and we have got fantastic outcomes for people. So the only message that I would say is that you don't have to suffer in silence. Please come out and speak to your doctor or speak to your friends, and try and see what else you can,
support
yourself.
in the community and their GP and other services.
Absolutely.
Thank you very much for coming to the program. It's really been a pleasure having you. Thank you everyone for watching the program, and it's been a pleasure having Dr. on the program. It's been an educative program. We are here to raise awareness, to encourage people to come out. Don't be shy. Don't think you'll be stigmatized. It can affect everybody. You never know who will be next. So the pressure on the society is huge. So please come out, speak to someone, seek help if you need help, and don't die in silence. And thank you once more for coming on the program. I hope to see you next time. Bye-bye.